In the world of hearing aids, how many big manufacturers are there these days?
You know, big, large ones, probably 6, maybe 7.
Yeah, yes.
And then there's offshoot brands that are buying technologies that are 4 and 5 and 6 years old. And then that gets into, you know, probably easily 20, maybe 30 more brands. So
tons of
about
second
30,
tier. Well, yeah.
You know, lots of different types.
But when we're talking top tier, you know, probably like 6.
Yeah.
Some people even say 5.
Right.
And all of these top tier companies make good products. There's not a study out there that shows, hey, consistently one brand is better than the other. There just isn't. These devices are pretty comparable. They're pretty competitive. These big companies love to compete with each other. But that being said, there are differences, right?
Right.
Like between an Oticon and say a Resound, there are differences. Hold on, pause just 1 second. We'll get back to our video. Please like the video, subscribe to our channel, turn on the notifications. We really appreciate it. Back to the video.
Let's get back. Sometimes it has less to do with the technology and more to do with the physical fit, like how it fits in the ear, or how it fits on top, or how their hair sits, or their anatomy, you know, the physical part. And so there are some companies that allow us to do a better job and also a better looking job. It's cosmetically more friendly, it's more acceptable. It's making the patient feel like it's not quite as noticeable. And so some companies are just better physically.
Yeah,
and so there's a bias, just the physical part. And then you take the piece back here, which is a common piece. It kind of sits up high, kind of in the hairline, but some of them are a little skinnier. Some of them are they're shaped a little differently, and it just fits their cartilaginous ear, you know, their anatomy. It's just a better fit. So having multiple brands that you can look at someone and size them up and maybe try different types to make sure we get it right for that patient, just in a physical way, I know that means a lot to patients.
Yeah,
just
so
the physical part.
They're physically different, right? The way the wires come out, the way that they sit on the ear, how fat they are, how well they sit on an ear can vary. But you know, specifically, I would say one thing that I really like about Oticon devices is that they tend to have a little more mellow sound. Mm-hmm. And every hearing aid manufacturer, the way that they process sound, their algorithms that they use to process and amplify sound are going to be a little different. Yep. And Oticon's is a little more mellow. Mm-hmm. So a lot of people that are real sensitive to harsh, sharp sounds, they do well with an Oticon because when they first put it on, it's not as overwhelming. It's a little more mellow, a little more chill sound. Mm-hmm. So that's one difference right there is Oticon tends to have a little more mellow sound processing system.
And one thing that's interesting is as we test the patient, we get an idea, don't we? As we go through a comprehensive test as to who might be more sensitive to those type of sounds. And letting individuals try different types of hearing devices to find that out, super important. The Resound device we also like a ton because it's a little bit more sharp, it's a little bit more edgy. People put it on and they go, "Whoa, I'm really hearing."
Yeah, we love the sharpness.
We're really making a difference here, and for those patients who tolerate a little bit more of a sound of that type of quality, it tends to be a really good fit for people like that. And so there's this mellow type of sound that we might get in an Oticon or a Phonak type device. And then there's a little bit more edgy, harsh, more crispy type sound that comes out of the Resound hearing devices. And so if your brain has been wearing a certain type of hearing device for many, many, many years, chances are you're kind of conditioned. You're kind of, you know how we talk about neuroplasticity and how your brain just gets used to something and it morphs and it becomes comfortable with a certain sound. I think the more severe an individual's hearing loss is, and the longer they've been wearing a certain technology, it might be hard to get them to try a different make or model because they're so used to a certain sound.
I tell my patients that a lot too. One factor, if you're already a hearing aid wearer, you've had hearing aids for a while, it's actually easier to stick with the same manufacturer. It's actually an easier transition if you stick with the same company. It happens with all the companies. Your brain gets so used to that sound algorithm that when you try to change and go to a different one, it's a hard transition. You stick within the same company and it's a much smoother, easier transition.
And each company does improve.
Oh yeah.
They improve their processing speeds, they improve their noise reduction, they improve their ability to be more directional with how they hone in, and they use these beamforming technologies. So they're all getting better at picking up speech and noise compared to what we were doing 10 years ago.
And they all have evidence, right? I mean, you talk to them, you talk to each individual manufacturer, and of course they're going to tell you theirs is the best. And they have evidence to support it. They have research showing that, hey, we're better than everyone else at this one little aspect. Right. But the truth of the matter is they're all competitive. They're all really good.
It's interesting how ear to ear, as we look at, even as doctors, as we research products, certain products fit us better than other products. So it is very interesting to look at the individual's anatomy. How are they, what is their ear canal like? What's the top of their ear like? Is their ear canal, or is their ear, the cartilage really soft and flimsy, or is it more of a stiff cartilage? And then how do they handle sound psychologically? So the psychoacoustic side of this, of how sensitive are they going to be to certain listening environments? There's really a lot to take in, as to help someone be comfortable, confident, well-connected, and not annoyed.
Yeah.
Those are all the parameters.
I mean, can you be successful with a Phonak? Absolutely. I've got lots of patients that are successful with their Phonak.
Yep.
Can you be successful with an Oticon? Absolutely. We've got lots of patients that are. Can you be successful with Resound? Yes. Yep. A lot of it comes down to individual anatomy, personal preference, and that's kind of where our expertise comes in. We're familiar with all of them, where we can look at a patient and have the ability to try different things and find what works best.
Okay, everybody, we so appreciate you watching the video today. If you've liked what you've seen, please like it, subscribe to our channel. It means the world to us, but it also means the world to other people who are trying to figure out what's going on with their hearing health. So thank you for watching.